Hey, so good evening, everybody. Welcome to Minnesota Ayurveda Association. I am the president of MA. My name is Asavari Manvikkar. I'm an Ayurvedic doctor. And I'm also director and administrator of Minnesota Institute of Ayurveda. So I welcome you all. So this is a little bit introduction about MA. That is Minnesota Ayurveda Association. It is a Minnesota-based non-profit organization, and it is dedicated to promoting authentic Ayurveda through education, professional development, community outreach, and advocacy. It serves Ayurvedic practitioners, students, educators, and community members interested into the holistic health. So our mission is to increase the public awareness and also understanding about Ayurveda and how to integrate Ayurveda into your own lives to support professional and ethics. So, the ethical practice of Ayurveda in Minnesota and beyond. We foster collaboration among practitioners, educators, and allied health professionals. We promote continuing education and networking opportunities and also advocate for the responsible growth of Ayurveda in the United States. So we have many professional members, and some some of them they are already into Ayurvedic field. So some are BAMS, MD Ayurveda doctors, some are practitioners, some are counselors, and some are health enthusiasts. There is also another membership category, which is a student membership, and the third category is general membership. And our annual membership is about $35, and we would love more people to join us into this, Ma, and bringing Ayurveda forward and bringing this community forward and becoming our member. So there are some specific membership benefits. So there will be professional listing on the website for the professional members, and there will be multiple opportunities to present during annual Ayurveda events as well as the webinars that we host every month. So there will be some continuing education programs, mini classes that we hold. There will be networking opportunities, mentorship opportunities, and there will be some discounts on Ayurvedic products and services from participating members. So there will be multiple opportunities to become volunteer and also serve on various committees as we grow. So thank you everybody again for joining tonight. And now I would like to uh, pass it on to Marita. So she will be introducing our speaker today.
Hello, everyone. Thanks, Dr. Asavari. Today, we are going to have Sunil speak on the pathogenesis of cyst. And he was actually my classmate in Minnesota Ayurveda, not Minnesota Ayurveda, but I forgot the name of our school now because
Minnesota
I'm
Institute of Ayurveda.
yes. Minnesota Institute of Ayurveda. And he's also been my classmate in another different class also. So Sunil is in the board as the program and outreach manager, and he's also completed his Ayurveda practitioner certification, yoga teacher certification, and he's also certified in Vastu and Jyotish. So originally he is a native of, he's been living in Minnesota, but he's from India. And I think he runs a business as a software technology company. Um, so he's very much into Ayurveda, and he goes to many different places to learn about Ayurveda, to expand his knowledge, and he's very passionate about this. So I know this is going to be a great webinar, and that will be helpful to a lot of us. So I'm excited to welcome him, and I hope you all also can welcome him. And I'm going to hand this over to Sunil to start.
Sunil, can you unmute yourself?
Oh, sorry about that. Yeah. Yes, thank you, Marita, for introducing and also, giving me this opportunity to present. We had a great presentation last week from Marita also that spoke about holistic healing. And the platform here is obviously to share and learn. In no way that we are saying that use this as a treatment mechanism. This is more about exploration of holistic science like Ayurveda to enhance our lives, to get a better understanding of our own health and empower ourselves to take charge. Like as we know, the healthcare system is very challenging, and we are here just to educate in the modality that we find very useful. And this is in no shape or form trying to guide people to treat a disease. So that's upfront, just so that we are not mistaken that hey, we talk about many things passionately, but Minnesota Ayurveda Association is promoting health and wellness, not clinical guidance. So that's where we are. And my presentation is today is also geared around that to empower you to learn about in a very practical way about that condition and sharing it from one point of view. As in yoga, we have what is it called, the yama, the last yama, aparigraha. Aparigraha means looking at things and respecting others' point of view. So I respect all different points of view, and we as practitioners of any kind, we have to look at things from many different. So even if you're looking at one disease and you see five different Ayurvedic practitioners, they might look at it from five different views. No one is right or wrong, it's just different way of looking at it. So I'm sharing my point of view, how I look at it in my experience. Is that so? Am I good to share my short presentation, Asavari? Should I be able
Yeah, you
to?
should be able to share it. Yeah.
Mm. Okay. All right. Now I just need to do the slideshow. Before we start, I just want to start with a interesting Jain prayer. I was born in a Jain family, and I want to share with you all a very rich prayer which recognizes all the teachers at all different levels, all the sages that have come before us, and there are layers of them, and we are right here. Like Dhanvantri is there, and Dhanvantri is in the middle of the layers of sages that have come. And for us, Dhanvantri is most visible. So this is called Mahamantra in Jain tradition, and this has no age to it. It's been from Jain tradition point of view, it has been there forever. It's a very ancient mantra. So I'm just going to introduce you guys to this. Namo Arihantanan, Namo Siddhanan, Namo Ayaryanan, Namo Uvajjayanan, Namo Loe Sattvasahunan, Eso Panch Namokkaro, Sattvapavanasano, Manglanancha Savve Singh, Parmang Havai Mangalam. Om Shanti. So today we are exploring the topic of Ayurvedic insights into women health from ovarian cyst point of view. And the reason this topic became more highlighted to me was because I was dealing with a case study of my own daughter for last couple of years, even though we have studied this, but having that first-hand view into the real practical side of Ayurveda as well as allopathy. the modern medicine, how they kind of, what is relevant where, when, and how, uh, kind of came to me, and I wanted to share with you all the real power of Ayurveda in explaining a lot of the unknowns. Um, we learned a lot in our AHC AP program, the theoretical aspect of it and also the practical aspect of it. But this is from my experience. I wanted to share. So why does focus on ovarian cyst? That's what, and that kind of also touches on PCOS, polycystic ovarian syndrome and disease, both of them. So holistic approach built on 4 foundational pillars. So this is, we all who know Ayurveda hear it again and again, and I think we need to see it again and again just to make sure we know how important this is. So Ayurveda approaches women health holistically. So you have to balance your diet, which is your ahar, your vihar, which is your routine, your sleep, and the vichar. Vichar is your thought process, how your mind is working, how you're handling what is coming at you in form of life, whether you're able to process, how you're processing this so-called stress. And any of these get disrupted, they kind of create a chain reaction. If you notice, if your ahar gets impacted, you will notice it will impact your routine, it'll impact your sleep, it'll impact your thought process. So they're all interdependent. You cannot say that, hey, I'm 100% in ahar, 100% in nidra, and 100% in vichar, but I'm 20% on vihar. It cannot happen. You will be at the best 70% in each if you're lacking in one, because they are so correlated. And that is something that we need to use our intelligence to accept and also have that awareness to see where we are falling short. And we live in the real world, so we are bound to fall short sometime. But when we have awareness, it does a magic in our intelligence system. There is a word that we use in Ayurveda, pragna pradya. Pragna pradya is meaning going against our intelligence. It's a very powerful word. It's saying that there is a underlying intelligence that is always alive and awake. And if we attach to that, it takes care of our body. And all of this, ahar, vihar, nidra, vichar, they're all connected to that core intelligence that is always running. And that's where women health is very much related to. So we can see how challenging it is to stay healthy for women in this world. But if we can keep these 4 pillars, that is the key. So number 1, role of routine. So that when we talk about ovarian cyst, PCOS, PCOD, you are in modern nomenclature, we are talking about endocrine system, and which is one of the many srotas together make up the endocrine system that we talk about. And that is powered by the sunlight. All life forms obviously is driven by sunlight, but what happens? So when we are exposing ourselves to enough sun and we are working in the sun, the melanopsin gets created in terms of the modern medicine, and that melanopsin is eventually is what is responsible for countering and creating melatonin. So if you don't have enough melanopsin, then melatonin also not created. So right now we are visualizing our endocrine system starting from, in women's situation, we are visualizing it from hypothalamus all the way to the ovaries. So that's that whole axis from there, is what drives our endocrine health. But the root is in the hypothalamus. So the sunlight drives our hypothalamus. That speaks to our pineal gland. That kind of is programmed to do secretion through your pituitary gland. So that is where the root, that's where the vichara is very important. That's what is driving that whole process, and your routine, which is the sunlight, exposing yourself and working out, having that physical activity. And the food is also important because that's what gives us the energy to do all that. So when the circadian rhythm breaks down, so does our hormonal signaling. So when we are not in sync with how the sun is moving, our meal times get affected, our sleep schedule gets impacted, and that breaks this axis, the pituitary pineal relationship, and causing endocrine system to misfire. So the physiological gateway through which imbalance happens affects our reproductive health too, as we'll see later on how the journey happens. So how does the imbalance to cyst? So the improper routine cascades into dosha imbalances. So improper routine will create dosha balances that also impacts our agni. So our agni goes down. As a result, our first dhatu is our rasa dhatu. That is impacted. The quality of that dhatu is not as good. So when rasa is impacted, the upadhatu, the very finer byproduct of rasa is artava, which drives the creation of the whole the secretions of all kinds of hormones to drive in a very concerted way for the egg's journey into the later parts of the women anatomy. So if that misfires, then that whole mechanism of the eggs releasing is unsynchronized, and it's either late or too early, and that mass that is created, that leads to the cyst. And it's kind of a relationship, if you think in terms of doshas, it's a relationship between kapha and vata. So when the mass is there, it blocks, the vata gets blocked. And that's when that whole air is pumping to create the cyst, and the original mass is encouraged by the kapha accumulation. So that's kind of what in little bit on a simplistic way goes on, but not to forget pitta also has a play, because pitta is also there, and that drives the kind of cyst that is forming. Because the pitta is coming, it will have inflammation in it, it will have blood in it, all that aspects is coming from the pitta side of it. So hypothalamus confusion, creating, if you look at it from the vata point of view, and if you take a microscope into vata, it is the fifth vata, which is the apana vayu, which is the vayu which is supposed to move downwards, that gets blocked. And that is what is causing those symptoms, which is pain, inflammation, blocks, and formation of cyst along the endocrine channel. It doesn't have to be just in the uterus or just in the ovarian section. It could be anywhere, wherever the vata is getting blocked and the kapha accumulation has happened. Um, so weakened by Agni has a big play in that. The Agni has gone down. That leads to the mass that is coming in, excess mass. Um, and obviously, as this is not addressed when this kind of activity is going on, and it creates a kavya gunya, it creates a weakness in the channel. And wherever the weakness happens, that's where, when you treat one cyst, it will again get formed because we are not addressing the weakness. And that is where the magic of Ayurveda happens. It not only addresses in its treatment that weak spot and the cyst, but also after the cyst is taken care of, the post treatment creates the strength in that weak area so that the kavya gunya, that pothole that is there is filled. So that now when the dosha imbalance happens in your life, those doshas are not going to travel to that location and create the cyst again. So when you see the recurrence of these cysts is happening because of that kavya gunya that is formed because of our negligence in that area. And you have seen, we all have probably seen the play of Kavya Guna in our life. If we get an injury in one area of our, especially post 40, when you're in your 20 and 30s, your physiology is different. But once you are past 40, you can see it more if you're a little bit aware. Any injury that happens, unless our doshas are balanced for a while, it doesn't heal that fast because the dosha spikes, it goes there. You might heal, but again it will recur. So it's the same play that happens in the recurring ovarian cyst is that kavya gunya playing. And that is one is addressing the cyst. Then you
I'm
got to
sorry,
address, yeah.
sorry to interrupt, but the presentation is not here. Can you please present it again? Like share it?
Okay. Let's see.
It just fine.
So which was the last slide you guys saw?
We can see you flipping through.
Okay. Are you able to see this or
Can
no?
you see the presentation? Yeah.
Can you see Ayurvedic view from imbalance to ovarian cyst? The slide? You can. Okay, good.
Okay, great.
So we'll
Thank you.
move to the next one. So one way to prevent it is to bring balance in our life. That we have to do to really address this, because you got to take care of the pothole, but you also got to take care of what we call in Ayurveda the hetu, the one that causes this. The cause is what, and the cause is those four pillars we talked about: ahar, vihar, nidra, and vichara. So one way to do that is having, alignment with the sun. When we wake up as close to the sunrise as we can, or a little bit earlier, and having a morning practice, so that morning practice helps us to align our mind and body. That is very important, and that's where comes into play the yoga, the meditation, the pranayam. That's, you could plug that into that. It's like tuning your radio. Remember, we used to have those old radios that our grandparents had, and used to, if it was not on a channel, it used to just make all kind of goofy noises, and once you found a station, then it was crystal clear. And that's what happens when we wake up, from sleep, because sleep was a different state. We wake up state, and our body is in one place, our mind is in another. We got to bring it together. We got to tune it so that they're speaking to each other. And that's why the morning practice is very, very useful. in keeping those 4 pillars. And then the day goes, you eat your breakfast if you're hungry. If you're a type which is Pitta type, then definitely you need breakfast most of the time. If you're Kapha dominant, you might not need breakfast. Then you have your main meal when your Agni is in a good state, making sure you have your bowel movements ideally before you take any kind of solid food. So that's an indicator. That's the intelligence. Again, the intelligence of our body telling us if there is no bowel movement, the body is saying, I don't need food. I don't have Agni yet. So if the Agni is there, then you will get hungry. Otherwise, you won't get hungry. And if your Agni is not in the right place, the bowel movement won't be in the right place. So first we got to address the Agni, and we got to take the herbal support for that for temporarily to get the Agni going so that we are able to get that hunger. It's very important to be aware of that. And then obviously movement, the exercise part of it, so that we are active, we're keeping our system active. Our bodies are, our dhatus are functioning, the dhatus are moving, so that there is a way for each of the dhatu agni to move and stay active. And as the sun is going down, our system also wants to slow down. We have to respect that and accordingly try to slow down and prepare for sleep. Now, this is obviously the utopian state, right? We are all living in the industrialized now in the AI world, which is ultra industrialized state. That means you're never done. Any projects we are doing, we are not going to be done, no matter when we start and when we finish. So we have to train our system to prioritize based on our health, because there is nothing more important than health. We are living in the most affluent country on this planet. And if we do not address health, who is going to address it? We have the choice. We have to give priority to this. If we say, no, my lifestyle doesn't allow me, find a way to do the best you can. And that's the percentage of health you're going to get. So we want to maximize the percentage of health that each of us can gain. And that's where, women health is aligned very much to this. And as I will kind of get into a case study of my daughter and see, and kind of give you insight into what went there, and what I learned from it in terms of all of this. So the Ayurvedic treatment recommendation for the cyst is obviously, as we talked in the context of the daily routine, the yoga and pranayama. Pranayama is especially the 5 pranayam, each addressing each of the vatas, the prana, udana, samana, vyana, and apana. There is a pranayam for each one. It addresses each one. So if you are able to do that, then you are kind of doing the maintenance cycle on your prana every day, that life force that comes in. That drives our endocrine system. That drives our hypothalamus. That is what keeps everything in the right place. That is the easiest, quickest, and cheapest way to keep our system in the right place, if we are able to have a regular yoga pranayama practice. Then comes our herbs. They are very important. Also, if our body is going in the wrong direction, if our intelligence has kind of is gone for a little bit, what we call, we are taken over by the pragna pradya. We got to first turn it in the right direction. And that's where herbs help us to change that direction. And in my opinion, that's all herbs should be doing. If we are taking herbs all the time to stay in the right direction, then what is the difference between taking an allopathic tablet all the time and taking herb? No, there is a specific thing that herbs are doing. Herbs are these very intelligent, very gifted nature's formulation that are there with properties that have relationship to our bodies, which we call, virya, vipak. All of that is how they relate to our body and function within our body to do specific things. But our body itself has an intelligence to take care of itself. So we got to use the herbs in the right context and not make it dependent on that. One therapy that in my experience, I thought is very helpful, at least if you're in the initial stages of, even in the later stages, but more so in the initial stages of cyst, is Nasha therapy, because you are treating right where the roots, right there. Nasha is a treatment of having herbs going to your brain, it's treating your tarpak kapha and sadhak pitta, and it's balancing those, and that's what is driving your hypothalamus pituitary. And if you're able to address that, you get the shortest path of treatment. Yes, if it becomes chronic, then you got to address many things. You got to address the whole endocrine system. But if you're able to recognize any kind of abnormality in your endocrine system, go to Nasha and either nourish or clean. There are two kinds of Nasha therapy that we learn. One is to nourish, another is to scrape and clean. So which is Virechan. So that you got to see where it is, and if you are able to do yourself, or you kind of get help from Ayurvedic doctors and practitioners to have them guide you into the right way of finding balance. And that's why it is important for all of us to see an Ayurvedic doctor or practitioner on a periodic basis, just to make sure we are in the right place with our health, and also educate and empower ourselves with the knowledge to bring our specific health in the right place, because it's very subjective. What you are going through, no one else on this planet is going through that. You are a very unique body, very unique composition. You need very subjective input from a practitioner, and it is hard to get that in many other modalities, but Ayurveda has it. That's how the practitioners are trained to see your state. What is your vikruti right now? And they can help you. So it's always individualized. Treatments depend on each person's prakriti, vikruti, and we need to consult with an expert. So if you want to do research, where in the Shastras or in the texts that we studied, where is a reference for cysts? In Ashtanga Hridayam, there is reference to it in Uttarasthana in chapter 29-30, and also which talks about Granthi and Arbuda. Those are the two Sanskrit words that cysts go by. And since Mamsa Dhat Dushti also manifesting as a Granthi, that's why it's cystic swelling is talked about in those sthanas. In Charak Samhita, that discusses Arthava Dushti and related dosha disorder across Chikitsa Sthan and Sarira Sthan. Susrut Samhita, it has more reference in there. It is there as a Artava Kshaya in Sutrasthan, chapter 15, sloka 12. Yonipad Uttarayantra, and that is chapter 38, sloka 10, 11. Then there is 18 and 12 sloka, and 20 is it addresses gynecological disorders in Sarira Uttarasthan, chapter 20 in Sarira and Uttarasthan. And also in Nidanasthana, there is reference to Granthi. Overall, if you look at these sutras and all three of these texts, you will find one common theme. That cyst is generally framed as a santarpajana vyadi, meaning accumulation vyadi. It is santarpana and apartarpana. You have read, right? Santarpana is one which is accumulation. A disorder of overnourishment, meaning all of a sudden we are pouring in food that our body is not able to handle, either because of weak Agni or because of dosha imbalances. And it's arising from lack of activity, sleeping during the daytime, that guru snigdha, I mean heavy and oily and sweet madhura ahara, having excess of guru snigdha madhura ahara, which is heavy, anxious, sweet foods, and psychological factors like chinta and shoka, meaning you are very always in stress kind of a situation or in some kind of misery, paralleling the modern sedentary lifestyle metabolic syndrome model. The pathogenesis involve, as we talked about it, kapha and vata vitiation. So our Jathar Agni, the main Agni, the Dhatu Agni, is not in the right place, and the Ama has set in, and there is Avarna. Avarna is something is obstructing. It most of the time it is Kapha, but it could be Pitta also. Like if you had too much protein that your body is not able to handle, that might cause Pitta Avarna. And then the Meda in the Atharva Srota, the Kapha, Vata, Meda Dhatu, that could be excess of fat in Arthava Srota, that could cause to Srotarodha. So that is kind of the theme that comes from when you study the Shastras. That's what it talks about. Some of the formulation that, we talked about herbs that are used to address, the cyst is obviously the Kanchanar Gugulu, the most widely used for any kind of Granthi. Punarnavadi Gugulu, if it is a kapha based. Chandra Prabhavati is a very, very good formulation for overall endocrine health. Somebody doing. And other formulation that I found very very useful is Varunadi Kasayam. That is a great formulation of herb decoction that is used for tumors and cyst. And Trifla Gugulu also plays a great role in clearing and balancing the doshas, taking care of ama, getting your agni up as well. So these are some of the herbs that our scriptures also talk about, and I also had the first-hand experience of using them, and it really did a good work. In conclusion, what balance is the key, align with the nature's rhythm. So ovarian cyst and related often from lifestyle imbalances affecting the endocrine system. Ayurveda offers a preventive and restorative path through routine, diet, sleep, targeted therapies, and consistent daily rhythm protects Agni, dosha, hypothalamus, that whole endocrine axis. Adopting these principles support lasting harmony hormonal harmony and for women health. So this is kind of what I had. One thing I also want to go through quickly, a case that for my daughter's situation, what I learned from her. So when we found out she was living on her own, she was in Spain for a year, and she grew up as a vegetarian. And she was in Spain, so it was the first time that she had to manage her own diet. And protein was the main focus. So she had never eaten as many eggs before as she started eating in Spain. Like every meal, she was having eggs. She thought, this is easy, get my protein, it's easy. So fine, nothing happened there. When she came back here, we noticed that, she noticed she's in theater, and she's very active in theater, and she had some commitments for 2 shows, and we noticed she was like having pain. And so we tried to treat her. We did not know what it was. She was abdominal pain, so we thought it's, some digestive issues. So eventually we got the tests done, the MRI, and we found there were 2 cysts, one on the left and one on the right ovary. The one on the left ovary was 12 centimeters, and the one on the right was 2 centimeters. So now at this point, this was a little bit outside my treatment, my pay grade. So I had to take this case to somebody who knew a lot more than me in treating uh, ovarian cysts. And this was a doctor in India who was highly educated in this area, and she works so and she was able to speak to me because I understand Ayurvedic. So her treatment plan, which you all will gather, was first samana treatment. So samana means we cannot disturb anything. We cannot bring anything aggressive because one of the cysts is 12 centimeter. It could make her ovary collapse if we do any kind of sodhana. So we went with 3 months of samana, actually 1.5 month of samana treatment, to see whether that does any uh, impact on the cyst that has grown a lot. And we also, when the reports came out, we could see the mass and everything. It looked like protein mass. So we could see the hetu. Hetu was excessive protein, and that was not digesting in her body. And the rasadhatu was throwing it as mala and was going in her system and depositing there. That's how we understood that. The herbs that you might want to know for samana, obviously we were not giving her any kind of aggressive gugulu or any herbs. No way. No kachanar gugulu, because that's sodhan. That is too aggressive. The herbs that we put her on was Chandrakala Ras, not Chandra Prabhavati. Even that is too much for her at that time because it has got Trikatu. It has got a lot of strong herbs in it. So Chandrakala is lighter form, and Dhanvantram Vati and Dhanvantram oil. And here's an interesting thing. My daughter, she was 19 at that time. It was her decision. I had to like, hey, what do you want to address pain? Should we get oxycodone or whatever, right? What pain? Because the pain used to come at 2 o'clock at night, the pitta time. Otherwise, she would not have pain. From 2 in the night to 4, she'll have unbelievable pain. So we were trying to manage the pain using salaki and using, hot or cold, mostly hot pad, and and just kind of giving her some Reiki and energy treatment. She took Tylenol only 3 times. She was for 30 days, because she could not go after that 1.5 month of watching with Samana treatment, we went for tests again. And the one of the cysts reduced, the other cyst did not reduce. That went from 12 centimeters to almost 13 centimeters. So that was not responding to the Samana treatment. So now what do you do? Ayurveda, what does Ayurveda say at that point? If you go to Sushrut, they'll say surgery. Don't play with it. It's blocking. So we had to find the surgeon who we can trust. And that is a different story altogether. I definitely encourage all women to have some relationship with a good gynecologist. And what we found out, we went to the safest place in town, which is Children's Hospital, because she was still 19. So she qualified, 18. She was 18 actually at that time. She qualified to be at Children's. And we did not get the right uh, guidance from there, in the sense when the head doctor there, who is like the main doctor of that area, she looked at it and she got really like, hey, this is too big, we got to cut her open and do the surgery. And being in Ayurveda, and and being a little bit aware of what all exists, it sounded like, why does one have to cut open for something like this? Why not laparoscopic? And she was not for it. So we had to take a second opinion. That also, when they saw it's coming from children, they said the same thing. But deep down, I said, no, there can't be. So we started talking to other doctors who had nothing to do with children's. And outside of here, like in New York, we had relatives, and in India. When they looked at the reports, they said, this is completely a laparoscopic case. You do not need to cut open. Cut open means 1 month, almost 2 weeks of healing time for a patient. It's a huge collateral damage to a patient. But when you go into the system, the reason they do it is, one, they're not skilled sometimes to do laparoscopic. Two, it is very easy for them to cut open and do it. Laparoscopic is a lot of work for the surgeon. So the reason I say that is, this is the reality of what you run into. We are in the Ayurveda world, but in Ayurveda, we sometimes have to engage surgery. So you have to know that aspect as well. You cannot just hand off and say they will do it right. You have to be engaged, whether you are a practitioner or whether you are dealing with yourself. And that was it. So the surgery, I luckily have a friend. She's an awesome gynecologist, but I was not thinking of her because her practice is in Buffalo, Minnesota. But when I saw all this going on in town, I said, well, I need to go to Leslie. So I said, Leslie, you got to work on my kid. So she's like, you're going to drive all the way? I said, I will drive to New York for the right person. Forget about Buffalo, Minnesota. So she did a fantastic job. Nothing, there was healing happened within a week. All has been done. And she has been on Ayurvedic herbal treatment, which is mostly addressing, as we talked about, taking care of her Kavya Gunya. Because first Sodhana, we did the Sodhana so that clean everything out. Now that the cyst is gone, there is no risk. And then the whole Rasayana. That is the building part of it. One of the best Rasayana is Amrita Bhalataka, which is Bhalataka is extremely heating, but is the strongest Rasayana. So she's was on that. She was on Sukumar Gritham, and Sukumar Gritham is an amazing formulation. Kashayam is also there, Gritham is there too. It's great for women health, and it is also very good for joint. Anyone has joint issues. So that was her journey, and she obviously had to keep an active lifestyle. She had to watch her diet. She learned that because the pain that she went through, she doesn't want to be in that pain again. So she changed her routine, making sure she has yoga and pranayama in her routine. making sure she's not eating processed food, making sure she's eating only when she's hungry, making sure that she's eating mealtime. We did not tell. She was just wanting to be part of that, and that was guided through Ayurveda, through that Ayurveda, another Ayurvedic doctor, and we were just a catalyst in the whole system. But a lot of learning happened, and I thought it would be worthwhile for me to share with all of you. And that's what my presentation is. If you have anything to contribute or any question, would love to have you guys' opinion. So.
Namaste. So much for the presentation. So I have PCOS myself, and I was diagnosed with PCOS. And just kind of wanting to know the importance of diet. Specifically, I have higher levels of testosterone and higher levels of, I guess, other like related hormones. So how much does diet play a part in balancing those hormones?
Obviously, absolutely. I mean, the diet will play a big role in sustained health. Right now, you need more than sustained health. You need more of turning in the right direction because PCOS is systemic situation, right? Because it could lead to little bit of malfunction in your um, uh, in your pancreas. It could imbalance, even your blood sugars, right? That doesn't happen. Interesting thing is women don't get diabetes, in their active years. But this could, because this is kind of creating confusion in your channel. And so you got to turn it in diet is definitely very important for sustaining whatever you do from herbal treatment, but you definitely need some kind of herbal regime to put it in the right direction. Right now, it's not in the right direction because it's probably creating some endometrium for you. It might create some, because it's going wild and crazy, and so you got to take that wild and crazy thing and turn it in the right direction if it is not already being. If it is already turned, then you just got to give it some time for it to, and absolutely keep your routine, keep your diet, as much as possible. And don't be alarmed. I think one thing I learned also in this from other Ayurvedic practitioners is, we get alarmed by the cysts. They said, be careful not to get overwhelmed by the tests because cysts come and go in our body because that kapha accumulation happens. But if you're able to balance your doshas, then they will go away. But at a given point of time, if you take the imaging, it might show up, right? And then it might go away. So you have to make sure not to mentally get stressed out about it. Give your body's intelligence, equip it so that it can work. It probably was, there was little bit of lack of awareness for whatever reason that this happened because we did not pay attention. There were symptoms coming to us. We were not listening because of the stressful life we live in. We are sometimes not able to listen to a lot of communication that comes to us from our body. So you just got to now add awareness, add pranayama for sure, because that will keep that whole prana going in the right direction, so that first it will stop getting worse, then it will start getting better. So that's where you have to, so the direction, and then address it definitely with some herbal regime you got to get on. Is that how, is that what your question was? I'm sorry, I'm not sure if I totally answered your question.
I think a lot of it was answered specifically with like the idea of getting into a good routine, implementing pranayama, and then also that big component about sugars and kind of like what one of a medical practitioner told me is like it's almost like having insulin resistance being with PCOS, and so that you have like more tendency to develop diabetes and so forth, just because of the systematic nature of the disease. Right now I am taking Sukumar Kashayam that's
Okay.
helpful in terms of helping me to have menses every month, because there was an obstruction of that as part of the PCOS, and also taking Chandraprabhavati, Arogya Vardini, and those have significantly helped my cycle. So prior to doing all that, I didn't mense, like it would be like 6 months I wouldn't mense. And then taking the herbs, I'm now like mensing every month or every other month. So there's a big change in just that in terms of my fertility. But I also think it's very important that I start doing pranayama and kind of get the whole circadian rhythm, how you laid it out. I think that's very, very vital and something definitely want to start implementing at home. Mm-hmm. So, thank you.
No, I think you are doing all the right things. I mean, just keep up. Don't give up. Keep up. Sometimes when mentally we are in a place where, hey, I don't see the difference, do not give up. I mean, you are doing every bit. It might be slow, but it is happening. It might be slow because it took a while for it to take, so to turn it in the right direction, it takes a little bit of time, but you are rebuilding that. You're not just doing a band-aid fix. You're doing a real fix. That is what you're getting out of it.
Yeah, that's a great discussion and wonderful presentation, Sunil.
Thank you.
Yeah, that was amazing. So related to Rini's question, I would like to say that there is a difference in the having a cyst on the ovary versus having PCOS. So PCOS is a condition which is a systemic all over the body. And that is more related to the immature follicles which are developing into polycystic. So you will see multiple cyst formation inside the ovaries. And the case which Sunil was talking about, related to his daughter, it is more about the cyst that was above the ovary. So inside versus above, and having two specific cysts on both sides versus having in one ovary all the inside, the follicles which should mature properly, they are not maturing. And there is also hormonal imbalance, that shows up. So that's so there is a little bit difference there. And what treatment you are taking is absolutely to the point, because that is addressing, it is definitely scraping, it is good for Vata and Kapha both. And the Chandra Prabhavati and all the other supplements and the Sukumara Kashayam that you are taking. So that addresses the other aspects too, which is related to the hormones. Yeah, but overall, like what Sunil has explained, that is exactly the situation, right? No matter what kind of cyst it is, whether it is on as well as inside the ovary or anywhere in the body. So typically in that pathology or the samprapti, this is what is the contributing factors, right? So the vata and kapha, they are mainly out of balance. Those are the main doshas which are involved. And then there is Agni, Ama. There might be sometimes Pitta involvement too. But typically, if you look at the Granthi versus Arbud, the biggest difference, I mean, these are uh, correlated, like there are some terminologies which are used. For example, benign versus malignant. So typically, the Granthi is cyst or benign versus when it becomes malignant, which is more related to all three doshas involvement. So that's what you will see. And the thing is also like there is a lot of ama, there are a lot of other factors involved in that too. So there is a difference, when we talk about Granthi versus we talk about Arbud. So benign and malignant, that is the in the modern medicine, that is what we correlate with those words. But otherwise, typically when we talk about the cyst, the one that, today, what Sunil was talking about, what he has explained, it is more related to the Granthi. Yeah. And, the understanding, like the modern terminology, and also trying to connect the dots and linking that with Ayurveda, that was really wonderfully done, Sunil. That was very, very good.
Thank you. One more recommendation I'll make for you is Nasha. If you're not adding Nasha, I think that will also, right, Dr. Asavi, that is probably because that's the root of that srota, right?
Correct.
So you have to decide whether you want to nourish it or you want to clean it. That is something that needs to be decided, because definitely it needs to be cleaned first, then nourish it. So right now probably it needs cleaning. So you need more of a scraping effect, more of virachan nasha. And Matthew would know that, right? So he knows the difference. So
Just curious for myself, what would you recommend for the cleaning and nourishing? What type of nasya would you recommend?
something with vacha would be good, right? That would be more scraping and cleaning, right? Something which has vacha in it.
Yes, that will be definitely, that will be more scraping.
Does Anutylam have vacha?
Yes. Yes, Anutelam does have vacha.
Mhm. And then what would
And
be
Anutelam is more virachan than, I mean, Brahmi ghee would be more nourishing. That would be Brahmana, right? So if you're doing, that would be once you are in the safe zone, then you do nourishing. At some point, once things are in the right direction, you want to nourish it then. Until then, it's probably more cleaning, making sure your hypothalamus and pituitary are firing properly, because that whole sadhak pitta and tarpak kapha that's sitting in there, that's what is driving all of that function there. So you're trying to clean anything that is blocking the function of those two.
I heard is spirulina something I could take too as a supplement? I think that's good for cleaning.
Could be
Okay.
more of a Western thing, I think.
Okay.
We'll look into that.
Okay.
Did you say spirulina? Is that?
I heard it's like is it kind of like it's like an aquatic.
It's like a blue-green
Oh
algae.
yeah. Spirulina is a blue-green algae, right? Is that the one? Yeah, that's more nourishing, right? That's for nourishment.
Okay.
Yeah, that has lot of minerals in it. Sits in for millions of years, thousands of years in the ocean bed, and they make spirulina out of. That's the yeah.
Thank you so much.
Okay. Anybody has any other questions or any comments or anything you want to add?
Yeah, I thought it was a really, really helpful webinar, Sunil. Even when you mentioned the Nasya, I thought that was really interesting that you're taking that route of therapy versus the traditional. And then about the food and like overnourishment, I think that is really helpful because that's something that we don't usually think about. So I thought that was really nice. Yeah.
No, thank you, Marita. It would be good to. I think the key thing is that whole awareness aspect, right? Letting the good intelligence in us to drive our daily routine, right? Because if we hand it off to that intelligence, then things are happening kind of automatically, effortlessly, and that's where we need to get to. Is we have been wrecked by the industrialization. We just do not know when the sun rises and when the sun sets because the lights are always on. We do not know that. And that's what is wrecking our system. And we just need to somehow bring that awareness to that. And no one is talking a lot about it on a regular basis. So we need to somehow inculcate that. And groups like this is great, right? Because it's a great reminder for all of us, right? To get back to that if we are not doing it. So I'm pretty sure every presentation on Ayurveda is going to talk about Ahar, Vihar, Nidra, and Vichara, right? That is just a reminder.
Right. And I would like to add something here related to the traditional way of looking at a cyst. So there is definitely major kapha involvement there. And that's how you need to do some, depending upon arha and anarha, right? Whether that person is indicated or not, based on the condition and all. The first line of treatment should be Vamana, because if you look at Kapha, as well as if you look at the Rasadhatu, for both of them, the major and very important treatment is going to be the Vamana to reduce that. And then you want to make sure that you are also aligning Vata, and the Vata needs to flow properly downward. So probably the later treatments will be Basti and Nasya and so on. But ideally for the cyst, when it is all related to kapha, you should be doing, some treatment which is based on cleansing that, right? So the first thing is work on ama, try to reduce all the, ama from your body. So Amapachana, then Agni Dipana. The next one will be Vamana. So that is the flow. It should be. And then you get into the other treatments based on whatever is necessary. However, we need to make sure that whether that person is having that much strength to undergo Vamana, right? How much kapha is there, as well as if it is possible to do it in the United States. So there are some other factors to consider as well. But when we talk about the traditional way of looking at a cyst, definitely that is how the treatment goes.
No, thank you for laying that out. That's very true. Yeah, Vamana is, as you mentioned it's a little challenging. It's a little bit horrific for some people, right, to think about.
Yeah, because it feels sometimes, like the ovarian cyst. So basically, the cyst is in the lower part of the body, and why will you do some treatment, which is Vamana, which is upper part. But ultimately, you need to look at the root, where that kapha is coming from. That is coming from the stomach. That is coming from the upper part, and that's how you need to be working on the root. If you look at the Rasadhatu also, how it is being created, and the connection of Kapha and Rasadhatu, for both of them. And then ultimately, if you look at the Upadhatu, which is of course here, Artava. So that's how all the connection will be, properly done if you are working on directly on the root and, reducing that kapha as much as you can, and then keep working on other factors, because without kapha there won't be any cyst.
Very true.
Yeah.
Yeah.
Earth and water, and there is some amount of air. So almost you imagine that, like how that samprapti is happening in the body, right? So just imagine that there is a clay, and then you are blowing a lot of air on the clay, so that will become solidified, right? So the clay is the earth and water, that is the kapha in your body that has increased. And now you are that vata that has increased later on, that is blowing on it, and it is making it thick, creating a cyst. Again, cysts are also so many different kinds. So you need to look at whether it is a water-filled cyst or whether it is more, what is in that cyst. So that also dictates related to how much involvement of dosha is there, as well as whether it is more parthiv, more earth-based or more water-based, and based on that, the treatment will be offered.
That
Mhm.
makes a lot of sense.
Right. Yeah, Matthew, you have a question?
Yeah, I was wanting to reference back to the case study on your daughter, Sunil. Um, so you had one ovary had a 3 centimeter cyst, is that correct? And the other one had a 12 centimeter cyst.
Right.
Um, you would do Shodan on the 3 centimeter cyst, but Shaman on the 12 centimeter cyst. I'm curious, how do we determine what's the threshold between a cyst being in the Shodan state versus the Shaman state?
So actually, it was summoned for both, right? You cannot do different for because your body is, the inlets are only one, right? For things to go in or whatever treatment you're doing. And the size is basically our ovaries are only few centimeters big. So if a 12 centimeter cyst is sitting on it, it is very risky that if it collapses, it might collapse the whole ovary. So that's where the size, if it was just a couple of centimeters, then probably cleansing would have been an option. For her, it is just balancing the dosha. When we say summon means what? We are just balancing the dosha internally. We are not pushing them out, right? But that did not do anything for that larger cyst because it's gone past that state, right? Because it's not just doshas anymore, it's just accumulating. As Dr. Asavari was explaining, right? That kapha keeps building, right? And it's just that the kavya guna is so strong that is whatever kapha is building is just going there. So you just have to cut that off basically at that point because otherwise it'll block.
So I guess to clarify my question, is say she didn't have the 12 centimeter cyst, but she had the 3 centimeter, or maybe it was 4 or 5 or 6. I guess how do we know um, how big is too big to do Shodan?
Just the proportion of the to the ovary.
Okay.
But that is where we needed the experts of the gynecology, which I was not, obviously, right? She was the one, and she looked at it. She said, "This is too much weight on the ovary. This is risk. We cannot give anything which is anything even close to Sodan,
Mhm.
right? Because that's as 18-year-old. If it was 60, 70-year-old, that's a different ball game then, right? So 18-year-old, you do not want to risk her ovaries, right? So it's a zero risk kind of a treatment is summoned, right? And then after that is not working, then the line of treatment is surgery as per Ayurveda.
Mhm.
You cannot really do anything, right? So you cannot let it grow because that has a tendency at some point will be too much weight on the ovary. So that's where the modern way of surgically removing came handy, you know. Oh.
And what was the doctor's name in Buffalo, Minnesota?
Dr. Leslie Akram.
Is she still practicing?
Yeah, she's still practicing. If you ever need a reference, let me know. She's a friend and her husband is a good friend. So I was not thinking of her because I like who those let me find here in the cities, And then it dawned on me that, oh my God, you just need to go to somebody who really cares, you know. That's the main thing. So
Yeah. So thank you for this excellent presentation and a great discussion.
thank you. Yeah, thank you for everyone's
Thank you,
participation.
everyone. It was wonderful. I've been listening to it, and I know a little bit about the case when you had the situation. So
Yes, yes,
I
yes.
know how hard it was, but I'm so happy to hear everything got resolved. and she's healthy back into her life and pursuing her passion, right?
Right, right. As a matter of fact, she's in the Fringe tonight. She's
Oh,
acting there in the Fringe Festival. So she's doing a play there,
wow.
yeah,
Wonderful.
downtown Minneapolis. I was supposed to be there, but I double booked, but I could not drop this. This is my passion.
So true, so true. We all have our passions, but I'm very happy. And thank you for inviting me, and I'll be happy to join many more to come. So
Sure.
keep in touch.
Thanks for joining. And our next presentation will be actually on September 15th. And Matthew Jarvie, he will be presenting, and his topic is really very interesting.
Uh-huh.
So it's about the music therapy and vibrations, so how they can be helpful to reduce all three doshas. So we would love you to join our next webinar, and please let about this webinar to know about your friends and family and everybody.
Sure, thank you. We'll do that. Mhm.
Hi, Sonia. Thank you for joining.
Yeah, I come here late. I have problems with my internet. That is very interesting. This. Are we gonna have the recordings? So I,
Sure. If you, can you message me your email ID so that I will send you the
yes,
recording.
I put it in the chat. You want me to send it to you?
Yeah, that will be great.
Just give me a second.
Yeah. All right. So thank you, everybody. And we'll meet next time on 15th of September.
Have a good
Thank you.
night. Namaste, everybody.
Namaste.
Namaste. Thank you.
I think
Thank
Nalia
you.
is here too.
Well,
So yes, thank you so much. Bye-bye.
Thank you, folks. Yeah.
Bye.
Thank you, Dr. Asavari.
Yeah, thank you.
You get it. You
Yes, I got it. Thank you, Sonia. Yep.
see you next time.
Yep. Sounds good. Yep. Bye-bye.